And the many things that we've been talking about over these past several months is about the actions needed to reduce transmission, to suppress transmission, so that it is down to a low enough level where we can start to reopen up societies again. And I think what we need to figure out, and what we are all figuring out, are ways to live with this virus, where we take action to reduce the transmission, so preventing clusters. The DG was talking about this today. This virus operates in clusters. It amplifies in specific settings where people come in close contact with one another and they're not taking proper precautions and the virus is circulating. The virus will use that opportunity to spread, and it will spread rapidly in these types of clusters. And we can prevent those by either avoiding crowded spaces and closed settings, by ensuring that we prevent the virus from entering those in the first place, like a long-term living facility, for example. We've seen devastating effects of when the virus enters a long-term living facility. We can wear a mask if we're in places where we can't physical distance and we have poor ventilation. There's a lot of things that we can do. And I think what we're trying to figure out is, how do we live with this while we take these necessary actions and we try to get on with our daily lives? As the Director General has pointed out, people are very eager to get back to their normal life, but I think what we are finding out is that our new normal includes physical distancing. Our new normal includes making some modifications to our daily life to keep ourselves protected, to keep us from getting infected, and to keep us from infecting somebody else. We all have that responsibility to play. And also, if we take these measures while reducing the virus, controlling the virus, we can get our other services back online. Schools can open, workplaces can open, essential medical services, which have to be reinvigorated because people need to get the services that they need, which are life-saving services. It's not just COVID-19 that we're thinking about. We're thinking about all of the medical needs that people have. Babies are being born, vaccines are needed, and can add to this. But we need to control the virus. And the reason we keep saying that this is so important is because we see that this is possible. And we see, with outlining the steps of having this workforce in place, finding cases, isolating cases, carrying out contact tracing, providing adequate care, targeting those clusters, we can really bring the virus under control. And that will save lives.